The physician to the president says President Biden now feels well enough to exercise after contracting COVID-19 last week.
Today marks the president's 5th day of isolation at the White House. Mr. Biden reportedly completed his Paxlovid treatment Monday evening, mirroring his Monday diagnosis. The doctor said his symptoms have now, quote, almost completely resolved. His pulse, blood pressure, and temperature are all, quote, absolutely normal. President Biden will continue isolating. The physician did not say whether or not he tested for COVID-19 today after testing positive on Thursday.
Additionally, a new report from the Kaiser Family Foundation has found 43% of U.S. parents with children under the age of 5 will not get them vaccinated against COVID-19. Only 17% of them have already or will get them immunized. Dr. William Schaffner joins us now. He's a professor of infectious diseases at the Vanderbilt University Medical Center. Dr. Schaffner, always great to have you with us. Thanks for being here. So what guidance do you have, particularly for those parents hesitant to vaccinate their youngest children against the virus?
Well, Tanya and Lana, I think most of these parents are indeed hesitant. And as they get their children ready for school, that's going to start the end of August and beginning of September. They'll be taking their children to their pediatricians and family doctors. And in that context, let them have a good conversation with that healthcare provider. All their concerns and questions can be addressed, can be answered. I hope they can be reassured that vaccinating their children is really the best thing for their children, as I certainly believe it is.
So, Dr. Schaffner, on Monday, the president's doctor said that his symptoms have, quote, almost completely resolved. I'm still waiting to hear whether President Biden has tested negative or is still testing positive. In either case, what are the next steps he's going to be required to take and why?
Yes, well, he is getting better. He was saying yesterday that he was still a little bit hoarse, but that's fine. That will resolve itself. If he is indeed negative, the general CDC recommendations are that he can go about his activities, but he should still wear a mask for the next 5 days, just to be sure that he's not transmitting the infection to anyone else around him. And we're certainly glad he's improving.
You know, of course, Dr. Schaffner, so many people have questions about COVID-19 as it evolves and new strains appear. The White House is gathering officials for a summit today centered on developing a new generation of vaccines more resistant to COVID-19. Why do you think this is happening now? And how long until we can expect these new vaccines to be produced and available?
Well, you know, Tanya, what we do is revise, update our influenza vaccine on an annual basis. And we're starting that process also with COVID vaccine. And the manufacturers have told us that actually sometime this fall, October, November, we may indeed be ready to get an updated COVID vaccine 2.0, as it were. It'll protect against the original strain, but it will have added protection against BA.5, for example, the latest Omicron variant that's out there. And we may be in for that for the foreseeable future, each fall rolling up both sleeves, one for flu vaccine and the other for an updated COVID vaccine.
Not sure that that's appealing to most people, Dr. Schaffner. But I'm wondering if this is in development right now, should people who don't necessarily need to have a booster at this moment, is it better for them to wait and try and get one of the more updated booster shots?
Well, the general recommendation is if the updated vaccine, if the booster vaccine is available to you now, please take it because there's still many weeks until this fall when we hope an updated vaccine will be available.
Yeah. And Dr. Schaffner, you know, there are so many people who are still getting COVID and getting quite, nasty versions of it. I mean, I have a friend who was just sick for 3 weeks, 3 solid weeks. So can we deduce that this current strain is a little bit nastier, or does it have to do more with people's waning, immunity?
I think it has more to do with waning immunity and the extraordinary capacity for this latest variant to spread so widely. It's extremely contagious. It can infect people who've been vaccinated and people who've recovered from COVID, but they will get a milder infection. Milder means that you don't have to go into the hospital, even though you can be out of sorts for a period of time.
All right. Always great getting information from you, Dr. William Schaffner. Thanks for joining us.
My pleasure. Thanks.